Hey everybody in 641, this is Jordan Weber. Just going to talk a little bit about the research and readings that I have been able to analyze and restructure into a article, hopefully for the end of the semester. I've been reading about the diagnostics and the prevalence of autism spectrum disorders, which has recently spiked in diagnostic rate in the past 10 years. Researchers are attributing that to the new diagnostic techniques and diagnostic uh, scales used by the DSM-5, which is a psychiatric list of variables that students with autism possess, such as repetitive behaviors, social interaction impairments, communication impairments, verbal impairments, and it's also associated with a lack of social reciprocity, imitation skills, and it also includes maladaptive behaviors, and then sometimes, in some severe cases, self-injurious or isolated behaviors. Um, to tell you the truth, I didn't know too much about autism spectrum disorders before this research course, so I want to thank everyone in the class for helping me along the way, including our teachers and my peers. Some of you have reached out specifically on the discussion boards, and my peers and my group have also given me some good feedback on my article. So I'm hoping to segue into yoga for autism eventually, but I'm still trying to get to the history and the facts about autism spectrum disorders before I just apply yoga into the research findings. So the past couple reflections and the past couple assignments, I've been speaking in terms of the prevalence rates increasing, and this could be environmental causes, but we do know that it is not because of vaccines. We do know that as you increase in age, you have a higher chance, and identical twins have a higher chance as opposed to brothers and sisters. Boys are more affected than girls. It's almost a 5 to 1 shot now, and there's different severities of autism spectrum disorders from low, medium to high. And the kids and the children who were not diagnosed were most likely the most, uh, I guess you could say, the least severe cases, and the least amount of concern was given to the people with higher functioning autism or Asperger's, which is all now the same. The DSM-5, the diagnostic manual, says that it's all the same now. So it's all autism spectrum disorder. There is no PDDs or pervasive developmental disorders. There's no Asperger's anymore. It's all under the same umbrella, which is autism spectrum disorders. So some people have lost their coverage, and some people have, maybe gotten a little bit more coverage. People that are in the military get better coverage, and coverage, really helps, especially if you're diagnosed at an early age. At the age of, it can be diagnosed as early as 1, maybe the signs and symptoms can start appearing as little as the first couple months. So clinicians, pediatricians, parents, awareness in America has rapidly increased because of the higher prevalence rates. But this isn't to say that there's more people with autism. It's just more people are being diagnosed, and whether that's environmental or genetic, that's still to be determined. And research is definitely going toward that route as opposed to yoga interventions. And so what I'm looking to achieve is a yoga intervention for children ages 6 to 18 with autism in the elementary, middle, and high school setting. Um, I looked at a couple articles, I think about 3 to 4 on yoga and autism, and 3 of them were pretty good studies that had pre and post data. Um, Imitation skills improved, cognition improved, social reciprocity improved, maladaptive behaviors decreased, irritability decreased, open-mindedness increased, and just being able to sit on your mat increased. So obviously people with ADHD and people with other developmental disorders have had benefits in yoga therapy, and so that's why we're seeing this rise in perceived efforts to increase intervention strategies, because autism is growing, and so now we have to find different therapies and different means for this new population that we're not really we don't know too much about, but in the past 30 years we've had a lot of breakthrough research, such as the applied analysis behavior strategy, where behaviorists such as Leo Kanner back in 1938 discovered the first 11 cases of children with autism spectrum disorders, and he classified them as autistic affect, a problem with the autistic affect. And his first article described 11 children, 11 different cases, and most of the parents were very high functioning, very high intellectual people, and the children had some of the same qualities growing up, as far as vomiting at early ages, not wanting to be fed, and just kind of pushing away their parents and any type of help, really. And so these students would go into the clinical setting with Dr. Leo Kanner in 1938, and he would observe them, and he could tell that there was something different about these individuals that was different than what was proclaimed as schizophrenia or another type of mental disorder. So he classified them as autistic, and this name and label changed throughout the years, and now we just call it Autism Spectrum Disorders, because it has a lot of different delays and impairments, but each specific case is different, and each specific child is different, and each specific person has a different level of need and prompting that needs to be made available for them. So research is still climbing. I know that Autism Speaks and big agencies such as Teach are paving the way right now, and we've seen applied behavioral analysis therapy proven to work, but in cases that are very limited and structurally enhanced by the best psychologists and best psychotherapists. So I feel like there is limitations to the studies where they've proven and actually clinically evaluated the children pre and post behavioral interventions, and seen half of the population in these studies actually come out of the autism spectrum disorder label. So that is very rare, but it is possible. But I feel like because of the circumstances and the scenarios, it's very unlikely that you will get out of that label. But I think with the right intensive behavioral therapy and the right means and parenting, I think anything is possible. Thanks a lot.